Have you ever stopped to look at your own feet? It may seem strange, but they say a lot more about your health than you might think. Even before symptoms appear in other parts of the body, the feet can send signals that something is not right internally. Studies show that many serious diseases, such as heart problems, diabetes, and even neurological disorders, can first manifest in the feet. This happens because the feet are at the extremities of the body and are the first to suffer from circulation problems, inflammation, and nerve changes. If something is out of balance in your body, your feet will probably be the first to feel it and show it. So, if you want to find out what your body is silently trying to tell you, start by looking down. In this video, we will reveal common but often ignored signs that appear on your feet and that can indicate serious health conditions. But before we continue, if you care about your health and want to receive valuable tips like this every week, like the video, subscribe to the channel, and activate the bell. This helps us reach more people and keeps you informed. And stay until the end, because the last tip may be exactly what you needed to identify a silent problem in your body. Toenails are like windows to your health. If they are healthy, smooth, uniform in color, and free of stains, this is a great sign. But any change in shape, thickness, or color can be a warning sign. For example, yellowish toenails may indicate fungal infections, which is already a cause for concern. But they can also be associated with chronic lung problems, especially if the color is accompanied by slow growth or thick nails. Blue or purple nails, on the other hand, suggest poor circulation or a lack of adequate oxygenation in the blood. This may be related to heart or lung disease. In some cases, people with cardiovascular disease present this symptom even before feeling pain or fatigue. What's more, dark vertical stripes under your nails, especially if they appear suddenly, can indicate more serious problems such as subungual melanoma, a rare but aggressive type of skin cancer. If you notice these types of changes, see a doctor as soon as possible. Another common sign is an ingrown toenail or one that grows irregularly. Although it may seem like a simple thing, it could indicate that your shoes are too tight or that there is a structural imbalance in your foot, which forces the nail to grow at an abnormal angle. If left untreated, it can lead to painful and recurring infections. If your nails are weak, brittle, or have irregular lines, it could indicate nutritional deficiencies such as a lack of iron, zinc, or B vitamins. These substances are essential for healthy nail growth and also play an important role in the overall functioning of the body. We often neglect our toenails because they are hidden most of the time. But now that you know how they can reflect your internal health, it's worth taking a closer look every now and then. Have you ever felt that your feet are cold even on hot days? Or on the contrary, too hot for no apparent reason? These temperature changes may seem normal, but your body may be trying to tell you something important. Constantly cold feet, even when the rest of your body is warm, can be a sign of poor blood circulation. This can occur when blood has difficulty reaching the extremities of the body, which is common in people with low blood pressure, diabetes, or vascular problems. In addition, in some cases, it can indicate a slow functioning of the thyroid, which affects the metabolism and consequently the regulation of body temperature. On the other hand, feet that are too hot, especially if they are accompanied by a burning or tingling sensation, can be linked to nerve problems, such as the so-called neuropathy. This technical term refers to nerve damage, which can be caused by diabetes, nutritional deficiencies, or even the use of certain medications. When the nerves do not function properly, the brain can receive distorted signals of heat or pain, even when there is no real cause. The most important thing is to pay attention to the frequency of these symptoms. If they happen once in a while, they may be linked to temporary factors, such as wearing inappropriate footwear or even stress. But if they become recurrent, it's time to take a closer look, and because your body may be trying to alert you to something bigger. It may seem strange, but the shape of your feet can change over time. And we're not just talking about calluses or bunions caused by tight shoes. Structural changes in your feet may be the first sign that something more serious is happening to your body. Feet that are too arched or dropped suddenly. If you've noticed that the arch of your foot has increased a lot, or that it's completely flat, as if the arch has disappeared, be careful. This could indicate a weakening of the tendons and ligaments that support the foot, something that can happen with age. but it could also be a consequence of poorly controlled diabetes or even neurological problems. In more serious cases, these changes can be linked to conditions such as peripheral neuropathy. And wait, let's keep it simple. This is a condition in which the nerves that control the muscles and transmit sensations begin to fail. This can cause the muscles in the feet to become unbalanced, changing their shape over time. Claw or hammer toes. Another important change to watch out for is toes that begin to curve upward or downward, like claws or hammers. Sometimes this starts with just one toe and spreads over time. These deformities aren't just uncomfortable, they can be linked to muscle imbalances caused by conditions like arthritis, diabetes, or even neurological disorders. If you're noticing these changes, especially if they're accompanied by pain, numbness, or difficulty walking, it's essential to seek medical help. The sooner you identify the cause, the easier it will be to prevent more serious consequences. Thickening or stiffness in the heel and sole. Have you noticed that the soles of your feet are thicker, harder, or stiffer than they used to be? This could be more than just dry skin or calluses. In some cases, this thickening can be linked to a condition called plantar fasciitis, which is inflammation of the tissue that connects the heel to the toes. But in less common situations, it can also be linked to autoimmune diseases or even acromegaly, a rare hormonal disorder that causes abnormal bone and tissue growth. Have you ever looked at your feet and seen deep cracks in your heels or thick calluses in certain areas? Many people think that this is just an aesthetic issue or a consequence of wearing bad shoes. But the truth is that these signs can be much more important than they seem. Cracks in the heels are common, especially in people who spend a lot of time standing or walking barefoot. But if these cracks are deep, painful, and take a long time to heal, your body may be trying to tell you something. These cracks can indicate severe dehydration, vitamin A and E deficiencies, or even hormonal problems. In addition, in people with diabetes, these cracks are a serious warning. They can become gateways for infections. Remember, if you have cracks that bleed, become inflamed, or form crusts, don't ignore them. Corns and calluses usually appear in areas where there is constant friction or pressure. However, if you're developing calluses in unusual places, or if they're getting really thick, it could be a result of changes in the way you walk, and that in turn could indicate orthopedic or neuromuscular problems. In addition, very thick calluses that don't soften with simple care could be related to circulation problems, especially in people with vascular disease or diabetes. If the skin on your feet is constantly dry, flaky, or looks white, even after using moisturizers, there could be an underlying condition, such as hypothyroidism when your thyroid is too slow, or a fungal infection like athlete's foot. These signs could also indicate poor nutrient absorption or a lack of internal hydration. Yes, drinking too little water can even affect your feet. Quick tip: if you're constantly struggling with cracked, calloused, or dry skin, try to take a look at not just your footwear but also your overall health. Your body may be crying out for help, and your feet are the first to cry out. Now that you understand how your feet can reveal serious health problems, it's time to take action. Taking care of your feet goes far beyond keeping them clean or cutting your nails every now and then. Small daily habits can make all the difference, both in the health of your feet and in your overall well-being. Examine your feet every day. It may seem like an exaggeration, but a simple daily inspection of your feet can prevent serious complications. Look for changes in color, swelling, blisters, cracks, or sensitive areas. For those with diabetes or circulatory problems, this habit is even more important. A problem detected early can prevent something much more serious. Moisturize inside and out. Moisturize your feet every day with creams designed for the area, especially in the driest areas. But be careful. Avoid applying cream between your toes, as excess moisture there can encourage fungus. And don't forget about internal hydration. Drinking enough water is essential for the elasticity of your skin, including on your feet. Wear the right footwear. It may seem obvious, but many people still choose shoes based on appearance rather than comfort. The ideal footwear should offer support, cushioning, and enough space for your toes. If you spend all day on your feet, choose shoes with good shock absorption. Avoid tight shoes, high heels for long periods, and flip-flops that don't offer support. They can cause deformations, calluses, and even postural imbalances. Keep your toenails well-groomed. Cut your nails straight and avoid cutting them too short. Poorly cut nails can become ingrown and cause painful infections. If you have difficulty seeing or reaching your feet, see a podiatrist. It's a worthwhile investment. Avoid walking barefoot in public places. Gyms, swimming pools, locker rooms. These environments are perfect for the proliferation of fungi and bacteria. Whenever possible, wear flip-flops in shared spaces. Preventing fungal infections is much easier than treating them. Take breaks and stretch your feet. If you spend a lot of time standing or sitting, take breaks to move your feet. Stretching your toes, rotating your ankles, and massaging the soles of your feet helps circulation and reduces the risk of pain or tingling. Don't ignore persistent discomfort. Constant pain, numbness, or burning sensation in your feet are not normal. Even if they seem like minor inconveniences, these symptoms can indicate more serious problems. And as you've already seen, detecting them early is the best way to avoid complications. Taking good care of your feet is taking care of your health as a whole. They support you every day. It's only fair to repay this effort with attention and care. So far, we've talked about many subtle signs that your feet can present. But at what point do these changes stop being something minor and become a real warning? This is a common question, and the answer is simpler than it seems. Whenever something persistent, unusual, or worrying appears, it is time to seek help. Wounds that do not heal. If you notice a wound on your foot that takes a long time to heal, this could be a sign of poor circulation, diabetes, or even a deeper infection. Open wounds are gateways for bacteria and can develop into serious situations if not treated in time. Constant pain or pain that worsens over time. Occasional mild discomfort is normal, especially after a long day. But if the pain persists for days or becomes more intense, something is wrong. It could be a problem with the nerves, circulation, or even bones. And the sooner it is identified, the better the treatment. Sudden changes in skin color. Feet that become very red, bluish, or pale for no apparent reason could be a sign of poor circulation, infection, or problems with the blood vessels. If these changes are accompanied by pain or swelling, do not wait. Seek medical attention. Frequent numbness or tingling. This often ignored symptom may be related to nerve damage. A common example is what's called peripheral neuropathy, which means that the nerves that are farthest from your body, such as those in your feet, are being affected. It can be linked to diabetes, spinal problems, or even vitamin deficiencies. Simply put, your feet are losing communication with your brain, and that's never normal. Unusual swelling in just one foot. If only one foot is swollen, this could be a sign of a localized problem, such as thrombosis, infection, or injury. Swelling in both feet could be linked to kidney, heart, or circulatory problems. In either case, it's essential to seek medical evaluation. Changes in the shape or structure of your feet. If you notice that your feet are becoming crooked, arched with a fallen arch, or with your toes curling downward, especially if this is new, see a specialist. These changes could indicate muscle or bone diseases, such as arthritis or bone deformities. Persistent bad odor, even with hygiene. A strong and constant odor may indicate a fungal or bacterial infection. If regular cleaning does not solve the problem, or if there is flaking, itching, or cracking, it is time to seek treatment from a specialist. If you have made it this far, congratulations. Few people pay attention to the signals that their body sends, and the feet are one of the most ignored messengers. But as we have seen throughout this video, they can reveal a lot about what is happening inside. The color of the nails, the temperature of the feet, calluses, cracks, swelling, pain. All these seemingly simple details can be valuable warning signs. When observed carefully, they can help detect diseases early, when they are still treatable and reversible. Taking care of your feet is more than just cutting your nails or changing your socks. It's a sign that you care about your overall health. So stop for a moment and ask yourself, have you been paying enough attention to your feet? If the answer is no, now is the ideal time to start. Check your feet more often. Notice the changes. Make small adjustments to your routine, such as moisturizing your skin, drying the spaces between your toes, choosing comfortable shoes, and avoiding walking barefoot in public places. Small actions can prevent big problems. And of course, never hesitate to seek medical help if something seems wrong. Remember, prevention is better than cure. If you like this content, like the video, subscribe to the channel and activate the bell so you don't miss the next ones. Comment below if you've noticed any of these signs and how you dealt with them. Your experience can help other people. And if this video made sense to you, share it with friends and family. You could be helping someone discover a health problem before it gets worse. Thanks for watching until the end. And until next time.